Okay. Hello, friends. We are back today again on the Saturday. I'm joined by Irene, my co-host, and Dr. Ankit Mehta, our pediatrician and pediatric intensive care specialist. But today, I'm going to ask you a question. What do you do if you are in a crowded room or you are in a crowded space in the times of COVID? Maybe you are traveling in a train or you're traveling in a bus or you are in a room full of people where you don't have space for yourself. So what do? It's simple. Just cough a little bit and you will see a lot of things happening. People would give you space, they would get away from you. So cough has almost become, or the sound of cough, whether you actually have a cough or no, if you just pretend that you're coughing, it's enough to create a lot of ripples. So people would make space for you. So it's like a very efficient tool in the times of this pandemic. Obviously not a great thing to do. I was just kidding with you just to start on the lighter note and to give you a hint that our today's session is dedicated to recurrent cough in children. Yes. We all know as parents that all the children, irrespective of where they are, will get coughs or colds, especially when there is a change in season, a bit of infection, even just otherwise. You know, it's not that all coughs cause problem or all coughs are certain things to be alarmed about. So in today's session, we are going to learn from Dr. Ankit a lot of things about cough, because parents are even worried about, oh, my kid is coughing. Can it be COVID? Right? Especially with children, we are even much more careful. So without any delay, I would now request Irene to start with her set of questions, and then will be my turn. Irene, please start it off. Thank you.
Thank you very much, Himanshu. Sorry, I think I was off at one moment there with the internet and issues like that. But otherwise, I hope that everyone is doing well. As he said, my name is Irene, and I work with Patient Support Services Africa, and I guide patients to get better outcomes out of their visits in the healthcare facilities. So Dr. Ankit, today we are talking about coughs, and let's start with the basics like we always do. What is a cough, and what makes it different between children and adults?
So first of all, thank you for this session. This is a session which is very close to my heart, because being an intensivist, I have also learned a lot of pulmonology. That means I have learned a lot of lung diseases for children. And these are the topics which are very common and they can be very alarming. Like parents cannot sleep if their child is coughing, and they are like in very, very anxious mode if your child keeps on coughing. So first thing is, as you have highlighted, what is coughing? So I'll just put it in a simple, like a layman language. It is a forceful expiration which comes from below the vocal cords most of the time. Okay, and it is so much forceful that you can give maybe millions of maybe viruses or bacteria in the surrounding area if it is an infectious cough. Okay, so what we mean by cough is we have got a lot of cough receptors. So obviously if there is cough, that there has to be something which gets stimulated and then you get the cough, right? So there are a lot of cough receptors in your pharyngeal wall, in your airway, and lower down also. So that means cough can come from above the voice box and it can come from below the voice box. That means you, even in a simple nasal and a throat infection, you can get a lot of cough. And even in simple language, if your child has pneumonia, they can also cough. So how as a parents you can identify that this cough is not great, that is what it is all about. And that's why I am here. I just wanted this to happen, that you should know that coughing can come from many mechanisms. And even a child, newborn, can cough every hour without having any problems. That means cough is protective, cough is helpful for human body, but in certain scenarios, it is not correct to take it as normal. Okay? Like a 2-month-old baby coughing infrequently, maybe twice or thrice in a day, sometimes sneezing, Otherwise, a healthy baby, feeding well, playing well, sleeping well,
Mm-hmm.
I don't see there is any worry. But they come in the OPD just to be ensured in this COVID pandemic. Sir, is there any chance of COVID infection in my child? Okay. And a
Yeah.
same child, maybe a 4-year-old, he has some chronic lung problem. I'll talk about that later in the session. But if he coughs, and then I'll be worried. Okay, at the same
Yeah.
time. Yeah.
Okay.
So I
So
hope
I'm
that
just
makes it
thinking.
clear that just to tell you that coughing can
Mm-hmm.
be because of multiple reasons. And the cough
Yes.
reflex, if they get stimulated, if the cough receptors are stimulated, then you can get lot of coughing. That may be because of infection. That may be because of some protection. Maybe you have ingested something, you want to immediately take it out, or even something which is very stinking or maybe not great, you can get irritated and you can get cough. Fine. So there are multiple
Okay.
reasons where a cough can happen, and sometimes it happens occasionally just in a normal kid also. Okay. Sometimes you also cough at times. Right.
Yeah.
Okay. Yeah. So
Mm-hmm.
that's how it is. Okay. But the only thing which makes you worried is a child airway is like this, very narrow, and the adult airway is like this. Can you see? So
Yes.
the difference is that if your child airway, which is very narrow, that means if your airway, which is the pipe which is taking the air inside, if it's get more narrow because of any infection, your child may be in trouble. Yeah. Fine. And that we are going to discuss in the next coming maybe minutes. Yeah.
Yeah. So as a parent, I mean, I have children, and if I want to differentiate the cough so that I know which one is serious and which one is not, what are some of the things I should look out for?
Wow. So that is the best part of the session maybe. So one
Mm-hmm.
thing that I'll give you 4 examples if you can give me just maybe like 3 minutes. Okay.
Yes.
So one is
Yes.
a child who is a 1.5-year-old kid, like 18 months old child. He had mild cough cold. He had a running nose. He had a mild fever up to 100 degree Fahrenheit, and he had maybe a hoarse voice, maybe a change in voice for one day. And now he's sleeping in the night, and suddenly you hear in the middle of the night, are you able to hear the noise?
Mm-hmm.
Hmm? So that is called as
Yes.
a strider. Can you see this? Can you see this? The airway
Yeah.
is going inside. That is called
Mm-hmm.
as laryngotracheobronchitis or acute croup. That means a child who had a simple viral infection or maybe a mild flu has now gone into a airway which initially I told you was like this, has become narrow, and the air, it is not able to pass through, and your baby is
Mm-hmm.
breathing very hard, very hard.
Mm-hmm.
I hope that is very clear. That is the
Yeah.
first cough. Okay, that is the first cough. Now again, a child who has been otherwise like maybe a 8-month-old, he had a mild cough, he had a mild cold, no fever, nothing. And now you see again in afternoon, maybe you want to feed the child and he is doing so he is trying to grunt. He's trying to make lot of, he wants air, but he is not able to take the air. So he's just trying to breathe hard or heavy and to take the
Mm-hmm.
air inside. So
Mm-hmm.
it's commonly seen in children who are infants and who have got an illness which is called as bronchiolitis. So bronchiolitis, your airway, your small airway means I was talking about right now a bigger airway. But
Mm-hmm.
lower down you go into the lungs, you got the airways which are very small. And these airways, they collapse because of the infection and you are not able to inhale the air. So the baby will make such kind of sounds do not come in adults. So that is called as they are passively trying to open their airways and breathe inside. So that is called as grunting. So if you hear a child grunting, if you hear a child having a stridor, it is a medical emergency. Okay, you cannot wait. Fine.
Mm-hmm.
Third
Okay.
curve, the third curve which I am going to play, I think you will be able to hear. So this is my third cough.
Mm-hmm.
I hope it was audible. I hope it was audible.
Yes.
So anyone, any idea? Irene, you help so many patients. Any idea what it is? You want me to play again? I can just play it. So what this cough is called as? This is a paroxysmal cough. So they keep on. Did you hear that? She was
Yeah.
having a barking kind of cough, and then there was a sudden noise which was called as whoop. If you remember, it is called as whooping cough. One of the most deadliest cough in the world, whooping
Yeah.
cough, which is called as pertussis. It is a 100-day cough. Fine. And in children, if they get it below 6 months, they have a very, very high chance of death. They have a very, very high chance of death. That's how deadly it is. So you get the vaccine. I know everyone knows the vaccine. It is the 6-in-1 vaccine which every government puts it for the DPT, diphtheria, pertussis, and tetanus. So the P is for the deadly 100 days cough. That is the pertussis cough. Okay, so that is the third noise which I am going to tell you. It is very, very troublesome, and it can land patients in emergency intensive care, and they can be very, very difficult to treat. I can tell you that. Okay, and the fourth and the final sound which I want to again play, it is very important. Now you should listen to this also. I hope there was something which you were able to listen. Maybe
Yeah,
a baby.
like wheezing.
Yeah. So that's
Yeah, it sounded like wheezing.
Yeah. So if your child has a audible wheezing, or if you are able to, audible means you are able to listen with the clearly with your ears. That is an audible wheezing. Otherwise, wheezing normally is heard on stethoscope also. Okay, that means again it is not a good thing. If your child is wheezing, definitely you need to get into the touch with medical personnel. But the only problem is sometimes people confuse it sometimes from the nose also. So if your nose is blocked, sometimes the patients keep on coming running that my baby is having wheezing. But the simple thing which I can tell you is just clear the nose with the saline drops and pinch the nose for 3 to 5 seconds. If the voice is gone, if that voice which was coming like a wheezing is gone, that means it was definitely of nasal block. Okay, and if it is persisting, that means your child has wheezing. So these are 4 5 sounds which will make me worry. So you are asking me when I should get worried as a parent. So first thing, if you listen any of these sounds, stridor, wheezing, a paroxysmal cough with a whooping, all these things are of worrying importance. One should not sit on it. In the middle of the night, if you hear such kind of things, I think it's better to get in touch with the medical person, or maybe rush to an emergency in case of if your child is heavily breathing. How do you see that a child is heavily breathing? Most of the times their nose, so they will have such this
Flaring nose. Yeah.
they will try to breathe heavy. They will have So they'll have some muscles which will be working for you, and they will be trying to tell you, okay, he's breathing fast. Always remove the shirt of the baby and see the abdomen will be moving fast. That means these are the signs that your baby is moving very fast. Okay.
Okay.
Suddenly a 20-month-old baby sitting with the elder sibling, something he has taken in the mouth, and suddenly he has become glue. That means it is a medical emergency. Okay, probably the baby has gone into choking. Okay?
Choking.
So these are some of the things where you cannot sit. Like if your baby has a mild cold, maybe a coughing, but otherwise baby is playful, not having much of fever, taking orally well, sleeping well, I think it can be a simple, mild upper respiratory tract infection. But if your baby is persistently having high grade fever, baby is dull, baby is lethargic, baby is using the muscles of respiration, which they usually don't do to, if they are looking very aggravated, that means your baby is in some trouble. It's better to check with them. It is a very late stage. If your baby gets blue, if your baby gets quite knocked out or not breathing well, absolutely, like these are last breathing. I'll just show you, like, so if they make such kind of efforts, it is a very late phenomena. I am not trying to teach that. I am trying to teach the things which are very early. Fine.
Okay.
Ankit, I would just like to.
We are always worried about the baby breathing fast. There are some situations, especially in young infants, where they suddenly stop breathing. Okay, some of the infections can make them suddenly stop breathing. So don't always look for fast breathing, especially for nurses also. It is sometimes the low breathing or suddenly they stop breathing. That is very important. Okay. So I hope that makes
I would just like to mention here, and Irene, you can also add to it if you if you agree to what I say. What you have explained right now is so simple for anyone to understand and remember. I really wish that there are medical practitioners who do this. I mean, the four things that you have told, I'm sure at least I'm not going to forget them ever. It's something which is very, very simple. So Irene, probably, in your nursing group, you can probably, tell people about these simple 4 ways. I mean, this is a life-saving method more than anything else.
It is.
So, thank you very much. I think we're doing something really fantastic today. Irene, please continue.
I definitely agree. And one of the things that we really, I don't want to use the word suffer, but then that is it. We are suffering through it is because every time the child coughs, and they cough a lot, especially when they start going to school, the sooner one cough, finishes, the other one starts. So we are constantly going to see the pediatrician for one thing or the other. So this helps because then you get to understand, okay, what kind of cough am I dealing with? Do I really need to go and see the pediatrician, or can I sit it out? So maybe the next question I have for you is, like here in Kenya, we have a lot of issues with pharmacies that just offer medication. I can walk to any pharmacy and tell them my child is coughing. Yes, they'll ask you what kind of cough it is, but they won't ask the way you have explained it. They won't ask. What they normally ask is it a dry cough or does it have phlegm? And if you say one of those, they automatically give you all kinds of medication, including antibiotics, which may not be indicated. So is this the time where you should be telling us maybe something a bit about that? Do we have to go absolutely to see the doctor for every cough? And if not, if we're just trying to relieve the symptoms of a mild cough, what are the solutions that we can use?
So I'll again take...
one thing I'm just adding to it, please do mention whether antibiotics in kids, that's very prevalent in India, that, anything the doctor prescribed 3 months ago, the same is repeated without seeing the doctor again. And it's an antibiotic. So also mention in this whether that thing is safe or no, apart from visiting the pediatrician.
So again, I'll take few minutes. I hope you can give me that much time. So one thing which you have mentioned is very clear. As they go to daycare and as they go to a preschool age, some of the babies can get respiratory infection every month, right? And that's how they keep on developing their immunity. And most of these children will outgrow all these problems by maybe 6 to 7 years of age. Okay, so the period between 2 years to 6 to 7 years of age is very prevalent to have upper respiratory tract infection. That means a child in every month may get a fever, cough, cold, right? And many of the parents relate this to that they are not having immunity. The patients who do not have immunity will develop pneumonia. The patients who do not have immunity will develop recurrent ear infections. The patient who do not have immunity will develop bad sinusitis again and again. Okay, so please do not correlate your kids having a simple mild respiratory infection with immune deficiency. That means they do not have immunity. It is a very big term, and it is the most pathetic way of using a word like immune deficiency. Because we see kids with immune deficiency and they are very, very troubling, right? So when you asked me that what happens if my child again and again gets a fever, cough, cold, or maybe such sort of things, fine. Main thing what I will be interested in, does he get any kind of maybe a ear infection or maybe a sort of pneumonia or maybe a sort of again and again sinusitis? So how do you identify them? Most of the respiratory infections will be fever, day 1, day 2, day 3, it will be high grade, it can be low grade, but most of the time by day 4, day 5, they will start reducing. So even if you don't use maybe an antibiotic, most of these patients, because they have viral infections, they will recover. And I am again telling that in viral infections, there is no role of antibiotic. And for these kind of infections, you cannot use lot of tests which are available, but they are quite costly. And because they are costly, you cannot do a PCR test like a COVID PCR test. There are many PCRs which can check which virus it has caused, but it is not effective for the government to do it. It is not cost effective for a parent to do it every time. So That means if your baby is running high grade fever even after maybe 48 to 72 hours, if your baby is having cough along with whatever cough I have explained you, if it is wheezing, if there is a stridor, maybe he is breathing heavy, then probably there is a time that we should go. If it is a simple mild cough, he's running around and having a cough, many of the parents will take the video and send it to their pediatricians and tell, see, he's coughing, but please remember he's playing also, he's otherwise doing fine, so please don't be worried. Okay, so that means for a baby who is otherwise comfortable, after the fever the baby becomes playful, active, he's coughing, okay, but it is not bothering him, fine. That means I think we can wait for first 2 to 3 days, right? What I mean by bothering is sometimes the coughing can be really significant, and they can keep on coughing, and they may not allow your child to sleep. They may sometimes the babies may pass stool because of the coughing. They might just do a potty in their undergarments, right? Their conjunctiva becomes red. They start having some of the bleeding spots in the eye. I think that is an aggressive coughing, and we need to take care of that aggressive coughing. Otherwise, if your baby is having an okay kind of coughing, then I think it's okay to wait for maybe first 2 days. Okay, and it is very important, as as Mr. Himanshu has told, many of the parents will start the same treatment which was prescribed previously for the fever, cough, cold, and after 2 days they will visit a doctor, or maybe 3 days, and they will tell that this medicine is not working. But for every cough, cold, you have to understand from where the cough is coming. You cannot use antibiotics in and out. They cause lot of resistance, they cause lot of problems in your abdominal system, and they kill your good bacteria. So there is no point using the same medicine again and again without asking. And let me go to the over the counter drug availability of cough cold medicine. You can ask my parents whom I talk to across Ahmedabad or maybe Gujarat. I rarely prescribe a cough cold medicine for first 2 years of age. Okay, these are completely not recommended for any child to use a cough cold medicine for first 2 years of age, until and unless you find them allergic, until and unless you find them that they have a cough which needs to be suppressed or maybe taken care of. You cannot buy a over the counter drug and use in and out. It is very important, because most of these drugs, if you look at the US recommendations, which is the FDA recommendation, they can sometimes cause a stroke, they can sometimes cause excessive sleepiness and lethargy, and sometimes they have been they can cause a lot of high BP. Okay, so these are the drugs which are absolutely not recommended for children under 2 years of age. Right? So what I mean to say finally is, I need to know the reason of cough. If I know the reason of cough, then I can prescribe the right medicine. Right? So no point going to a pharmacist and just asking for a cough cold medicine. Right? And I can tell you, dextromethorphan, phenylephrine, these are not the drugs which are to be used in children. Right? These are commonly used in adults, but many of the pediatric drugs also have such combination, and I think they have to be reduced. Their use has to be reduced, and especially for parents who are listening, then please listen. Sometimes they have a paracetamol also. So they keep on giving double dose of paracetamol, one in the cough cold medicine and one for the fever again. So they use double the paracetamol, right?
Oh my!
Please be very careful. It is not a joke.
Yeah. Sure. Yeah. So yeah, that is really helpful, because there's a lot of information you're giving that people don't know, especially the side effects for these cough syrups, and because the children are very small, we really never get to understand how they're affecting them. And I can't remember the last time I even went to hospital and somebody decided to check the blood pressure of my child. We automatically check for adults, but not for children. So you can imagine.
So many of the times you will just tell that he is ill, and probably you will not even imagine that these are the side effects of the medicine. Correct?
Yeah.
Because there is no way you can prove an association between all these things. You need a big long-term research to prove all these things. But that's why they have not been recommended by many of the good hospitals, or maybe many of the best researchers in the world.
Yeah. So one last question from me before I hand over to Himanshu. So we have asthmatic children, and they cough every so often. Is it dangerous? And what advice can you give to parents who then have asthmatic kids?
Fine. So because you are taking it very specifically to the asthmatic kids, first I would like to tell you that we maintain a diary of cough for asthma children. Okay, so
Mhm.
the most important thing is, when does the coughing come? If the coughing is coming mainly in the evening and the night time, and it is making him wake up from the sleep, or it is the early morning cough which is making him wake up from the sleep, and maybe it is making him vomiting, and the other thing is if he is running and coughing, these are the signs
Mhm.
they have to be controlled, and I think they have not controlled asthma. Okay, that means if they have a nighttime symptoms in form of coughing, and which is waking them from the sleep, and which is making them do vomiting and feel better, and if they are going to, they are running and they are coughing and they are sitting, maybe they are not able to perform well, probably their asthma is not controlled, you need to go and talk to your doctor, because it is a taboo not to use asthmatic medications for long. But to be very frank with you, many of the world class, maybe runners, maybe one of the world class players use them often, and it helps them and they have no problem, because they are asthmatic. You can still do whatever you can if you have a controlled asthma. So asthma, parents are worried about asthma, to be very frank with you. You can't
Yes.
label them. Even doctors are worried. If I will tell that he has asthma, they will not return to me. Okay, but we have
Yes.
to tell them. Yeah. So asthma, I think you need to focus them differently from this group of patients which we are discussing.
Okay. Himanshu, over to you.
Yes, I would take it up. Irene, now I think the information that you've shared, Dr. Ankit, has been very precise, and it's a very honest opinion that we can see, which is usually not seen by the doctor. Sorry to say that, but the way you have put it across, like you're actually trying to help parents understand the graveness of a situation, which is very important. And especially when you said about medication, we have a habit as parents not to read the contents of the medicine that has been given. So that is something which I request everyone, especially after what Dr. Ankit has mentioned, that if you are giving double dose of a medication, be careful. Please read it carefully and cross-check with your doctor. I mean, doctors are not gods. Sometimes there could be small errors. Maybe they have written something and an equivalent compound has been given which has another mixture. So it's not a doctor's fault, but it could be the dispensing error. So please make sure that you read carefully the prescription as well as the components of the medicine that is being given. Dr. Ankit, I have a few questions which are not directly related to medicine, but because we all come from a third world country, developing country, there are some essentials, the community essentials which happen. So whenever a kid has any kind of infection, whether it's a nasal congestion or it is coughing, usually the first solutions come from the kitchen. Like, uh, like I remember when I was a kid, and even now for that matter, the first thing that comes is probably honey or ginger or turmeric. So I want to understand, does it really help? If it helps, it's fine, or does it have any kind of side effects when it's given to kids or children in general? Both, because this is also used for infants as well as adults. So if you can just highlight few
So,
points on that.
first of all, I think everyone should know that obviously we practice allopathy, but a lot of research has gone into these kind of medicines, and I have no problems telling that some of the medications have been used even by us, and they have been quite found to be useful, and they have been prescribed in our medicine books also, like especially the tulsi. If you can, I hope you get that in maybe Africa. I don't know. So
Yeah,
one
holy
is
basil is available everywhere. Yeah, it's a
So one
plant
of
that
this.
grows
Other
tropically.
thing is the honey. So honey is usually recommended above 1 year of age. It has been found to be very soothing agents. And some of the times, though, it is very difficult to differentiate between a dry cough and a wet cough in children until and unless a pediatrician hears it. Because most of the times, parents are not able to differentiate whether it is a wet cough or a dry cough. So I think for a dry cough, it has been found quite useful. Then you can use the what you told, basil plus honey. Okay, and turmeric has been used quite frequently, but I am not very sure that I know the evidence about the turmeric. But there is a clear evidence for using honey plus steam plus tulsi water or a basil water for these children. The dose can vary, but these are the very soothing agents and helpful in dry coughing. There is no doubt. So for initial mild cough, maybe we can use it. But as Mr. Himanshu has told, if you have any of the warning signs, which I am again repeating, your child is having significantly high grade fever, your baby is looking dull and lethargic, maybe he's having bleeding from nose along with the nasal discharge, maybe coughing with stridor, wheezing, coughing incessantly, breathing fast. I think these are the children who should not be given such kind of medicines, because they can have a very bad, maybe an upper airway problem or a bad lower problem like a pneumonia. And if you keep on sitting in that, you can make a lot of complications in such children. So basically, you wanted to know, can we use it? I think we can use it. But honey, be careful above 1 year of age, because honey under 1 year of age has been associated with botulism, which is a very dangerous disease and it is not recommended. Botulism is a sort of paralysis which happens in a young baby, and you will never even come to know why it has happened. So many of the tests, many of the places tests are not available. So please be very clear that don't use honey under 1 year of age. And you can use maybe a warm water sips also. They are quite soothing, like a lukewarm water. It is quite helpful. And sir, don't mind, but I even don't know about much of ginger, though we routinely prescribe for adults, maybe like a ginger tea or maybe like a turmeric milk, but I am not aware much about that role in pediatrics. But definitely steam plus honey plus tulsi, they are quite good. And even we prescribe it quite often.
Okay. Yes, I have a question.
To be very frank, between 6 months to 2 years, first thing I ask them to keep the nose clean, because most of them are nose breathers, and if their nose is blocked, they are not able to open the mouth and breathe. So first thing is to keep them comfortable. Second thing is I ask them to give them lot of lukewarm water, maybe every hour a spoon of water for kids between 6 months to 18 months of age. And then if required, I may ask them to prepare a basil water and use them.
Okay.
And above 1 year of age, they may add honey also.
Okay.
I think you told from the kitchen, and we are very good at kitchen. Most of the Indian public.
Yes, I have a question. Well, I was thinking about it just now, and I said, let me ask it, because I know someone somewhere is seated wondering. You kept repeating high-grade fever, high-grade fever. So maybe we need to define what high-grade fever is.
Absolutely.
So that when someone sits there and they have, which, by the way, you need to have a thermometer. If you have children, please have a thermometer at home so you can be able to check temperature. But Dr. Ankit, please tell us what high-grade fever is, so that we can be able to.
What I meant, I am really sorry. Yeah, so I'll clear this out. That is called as hyperpyrexia, high-grade fever reaching up to more than 103. That means I think we need to meet the, especially the pediatrician. Why I am telling? Because children, especially when I am talking children, it is under 2 years or 3 years of age. If they have a very high grade fever reaching up to 103, 103.5, 104, that means I think we need to rule out a bacterial infection. That means we need to rule out that there is no bacteria in the blood. So that's why you need to see your doctor.
Okay. Thank you.
So any parent who gets high grade fever means 103 and above. And if you are taking it in the axilla, be sure to add 0.5 to 1. Be sure to add 0.5 to 1 to it.
Okay.
Okay.
That's interesting. I didn't know that.
Yeah. I mean.
No, because babies will not keep the oral thermometer, right? It is very difficult. You know that.
Yes, I agree.
And most of the parents use that gun thermometer, which may be an another day topic, but it is, So that's what the high grade fever is.
Okay,
that was
thank
quite
you.
Interesting. Very thoughtful of Irene that you asked this question. Even I did not know technically that one needs to add a little bit of temperature when you are taking from axilla. So that's a big information as far as I'm concerned. Dr. Ankit, another question, if it doesn't sound stupid, even if it does, I'll request you to answer that. Now, we use menthol-based ointments to be applied on babies, kids, right? And then probably, or sometimes I've seen parents putting a little bit in the steam water and then making them inhale. Now, two questions. One is, first of all, whether if it's an infant, as you mentioned, maybe up to 6 months or 1 year of age, is it safe for us to apply these ointments on the skin? Second part of the question is it safe for us to, put these or dissolve them in steam water and then do the inhalation? So there are two questions as a part of it.
So just a one word, it is no, complete no. Fine. You can use a steamer. You can use a steamer which are now available, which can direct the steam to your baby. So there were traditional ways of giving steam where we used to put it in a bowl and then make the baby do it in the bowl. And you know that children's skin are very soft and very gentle. And sometimes we have heard that they have got burned. And that is not a good thing because they are crying, they cannot do that. So I'll tell that please use a steamer which is now used to directly give the flow properly, and then you can keep it even away. And second thing is there is no evidence to add any such kind of thing, or maybe rub something on their chest. I know there are many major brands which do it in India,
so
but I'm sorry to tell that I may not endorse it and I have not used it, and even the literature or the research doesn't support it, and there is no evidence that it helps extra.
Thank you. So that's an eye opener again. And actually, when it comes to kids, when it comes to infants, we don't even think much. The moment we are told that do this, we just close our eyes. Okay, we want the kid to be fine. So that's the whole idea. And probably that focused approach towards just making the kid fine quickly does not make us ask certain questions. That's what I
I'll just add that I think there's an information which is lot of information which is available, but just to make parents here aware, you cannot look at any of the evidence which are there in the Google. There are ways where you have to search the Google in an appropriate manner and maybe look into that scientific manner. So you may not be able to do that much because you are not aware of the subject in that manner. So I think there is no point reading Google and doing it immediately. So Google sometimes may be wrong also. And you know that information can be put on Google by many of the means. Correct?
True. Absolutely true.
As you correct me if I am wrong in this, because you look after all this IT and all these things. But I know that there are ways.
In fact, that's something which I wanted to mention towards the end. As we are approaching the end of today's session, I would like to share with all our viewers that because our kids are not born out of Google, please do not Google them. Google about the diseases. Google, in fact, in medical science, because I deal with a lot of patients, I tell everyone that you choose. You want treatment by Google or treatment by a search engine, because the information given there is extremely specific. We don't even know for the region from where we come whether they have got those cases or not. So it is, a lot of it is demographic based information, which most of the people would not understand or would not even be aware of. So please, friends, you can Google anything else, but do not Google medication. Do not Google, whether I can try this with my kid, whether I can give some pills, whether I can self-medicate. So self-medication is something which is dangerous for everybody, even more dangerous for kids or babies, because they do not have a reserve as much as what adults have.
And so one more thing just to add, sir, children are not mini adults. So sometimes the adult is taking the medicine and they do it half, one fourth of it, and then they will give it to the kid. That's not the way to give it. Right? That's not the way to give it. Be very careful. Be very careful. They don't want to go to a doctor. 3 of them have developed maybe a cough cold. 2 of them are adults, so they will give half the dose, 1/3 the dose, and that's not the way to give to the child.
Fantastic information, Dr. Ankit. Irene, you look a little puzzled. I think you also got to learn a lot. Huh?
Yes, the way he's saying it, it's those things that people do but never really think about. And it's true that when you have 3 or 4 kids coughing, you're thinking, why should I go and buy medication for each and every one of them? Let me just buy one and then do quarter for this one, half, one for that one. And then, so he's very practical, which is a good thing.
Right. So friends, this brings us to the end of today's session. It has been very informative, at least for me, I'm sure for you all as well. Dr. Ankit, thank you very much for the amazing information you have shared in a very simplified manner. The most important part is whatever you have mentioned would stay in our memories very easily. One doesn't need to, remember anything. And friends, This particular session is available on all our social media handles. Please feel free to visit in case you have missed it on Zydus Hospitals as well as Patient Support Services Africa. We will see you again next Saturday at the same time, same place. Stay aware, stay happy, stay healthy, and please, kids are not mini adults. Do not experiment.
That's what I'm taking home with me. Yes. Thank you.
Thank you. Thank you.